A few weeks ago, I got home in a rush. Hurtling into my apartment, I sat down on the sofa, opened my computer to an email I just received. Lab results from a blood test. I was instantly confused by a list of biomarkers, colors, sliding scales. Of course, red wasn't good, but how bad was it? And what if I was just outside the range? I wanted immediate answers, so without thinking, I downloaded the PDF, uploaded it to Claude, and asked it, imagine you're my doctor. What would you think? The answers were immediate. I felt like I had a good sense of the results. I asked a few clarifications, and eventually I walked away feeling pretty pleased with myself. It wasn't until a few hours later when it hit me. I had just put my own protected health information into a completely unprotected portal. My lab and birth dates were now in an amorphous cloud linked to my name. What's worse? I wrote the book on healthcare data privacy. No, actually, I wrote a book on healthcare data privacy. I wrote it 5 years ago, and I should know better. With absolutely no judgment, raise your hand if you've asked ChatGPT a question about your health. Now, keep your hand up if you put potentially sensitive information into an LLM. You are in good company. OpenAI says that 40 million people a day are asking ChatGPT questions about their health. 1 in 4 users are asking it a week. That's 230 million people, equivalent to the 6th most populous country in the world. To be clear, I'm not judging. You heard me. I am in your same boat. But I think we need to have a frank conversation, us hand raisers, about our healthcare data privacy, because the world is changing rapidly, and I don't want you to suffer what I did getting hacked. So it's 6 years ago, and I'm sitting in the hospital. I have an IV in my arm, and iron is slowly infusing into my bloodstream, burning as it does so. I feel my phone buzz, and I see an email from United Healthcare. My data has been hacked. They make it seem corporate and minor, but a quick Google shows the truth. Russian hackers are holding the company ransom, and United does not want to pay. So all of our data goes into the dark web, where anyone can see it. Any insurance company can price my rates higher, my life insurance premium could skyrocket, and any potential employer could decide they don't want to hire me because of my potential health costs. I could be one of the hundreds of thousands of people whose medical identity gets stolen every year, which not only means that I get fraudulent bills and false information in my chart, but takes on average 200 hours and $14,000 to fix. I feel furious and vulnerable. So I get a grant to write a book on healthcare data privacy. I interview 70 experts, take classes in privacy law, talk to everyone I can. I end up realizing that privacy is a deeply personal choice. For some people, the threat of their data being out there, even if they're fully healthy, is horrifying. For other people, they don't really care. In fact, they might appreciate advertising tailored to their specific health needs. Now, I won't go into too much detail about what I recommended in the book. You can buy my book on Amazon if you want me to reduce my GSP loan. However, I will say I walked away feeling like we could do whatever we could and should do whatever we could to strengthen health data privacy protections. But it's been 5 years since the book, and a lot has changed. First of all, there's been 15 new state laws protecting our consumer data, including our health data. But the risk has also grown. In 2024 alone, 3 in 4 Americans had at least some health data hacked. So all of you have had your data hacked. That quadrant over there, congrats, you're safe. But not for long, because on average, half of Americans will have at least some data hacked every year. And while you're probably imagining this, which does happen, it's also this. It's companies like GoodRx, BetterHelp, Hims and Hers selling our data to big tech and advertisers. It's also these big data brokers that are compiling all of the data about our health and selling lists every single day of people with HIV/AIDS, people who want to lose weight, people with depression. And then there's AI. AI makes tremendously large data sets incredibly valuable, and there are tools that can help us understand our health, even if not perfect, in new ways. So, what do we do now? Well, I think the cat is out of the bag when it comes to our healthcare data privacy. In fact, I think we've had the wrong focus. HIPAA was passed 30 years ago with the idea that we can protect data in the formal healthcare system. It never applied to things like digital health or tools. Now, that's clearly not working. The formal healthcare system is being hacked all of the time, and those digital apps and tools that more and more people are using, they have to rely on consumer state laws to protect them. So we end up in a situation where things are going to get a whole lot messier with AI. You hand raisers, I just don't foresee you stopping to use AI to answer questions about your health. That immediate impulse to get answers in a system that's slow and confusing, that's not going to go away. And the AI companies know that too. They're now launching products so you can connect to your health records and get better answers because you have hundreds to thousands of pages of, proverbially, of your health data in your portal. That means better answers. It also means more risk. So I reached back out to those privacy experts and asked them, what should you do now? And everyone has a different opinion. Some are using AI tools themselves. Others told me to tell you to stay as far away as possible. The truth is, people don't know the risks of using AI with our data today. That's because these models and the terms and conditions are constantly changing. You have companies that are storing massive amounts of data, a cybersecurity risk that we've never seen before. And companies like Anthropic are pulling back on internal privacy policies because they don't want to fall behind in the AI arms race. And then you have the fact that AI companies can change the terms and conditions at any point. Companies have done this in the past. Think of 23andMe, which sold data before it went bankrupt. So, all of this makes me want to ask you a question. Are you making an informed trade-off when it comes to using these tools? Here's what you need to know. If you're going to use an AI chatbot for your health, know that that data is not protected by HIPAA. It's protected by state privacy laws. If you are in California, you have a right to know what's being collected, to access it, and to delete it. Those rights are not automatic. You have to exercise them. Think carefully about the data that you are going to put into those chatbots, especially if you're going to connect to your medical record. If you do end up connecting to your medical record, slow down. Think about, would you want a potential employer to see the data in there? Are you going to need security clearance at some point? Pay extra caution to your mental health status, HIV status, reproductive health. Courts are already subpoenaing chat records about abortion, for instance. Think about this. Can you redact the information or ask in general terms versus specific? Most of this comes down to you. These tools have tremendous power, but make a conscious trade-off to use them. And consider it this way. If you have a long conversation with ChatGPT about your health, say things that you're slightly ashamed of, and you get an Instagram ad the next day that's way too close to what you told it, are you used to it? Or are you going to be squeamish? That is your risk tolerance. The kicker is, most of your data is already out there. So if you use these tools, at least you get some upside. As more of us use AI for our data and more health information flows between these tools, there's going to be more breaches and there's going to be more victims. I think we as a society need a new paradigm. Don't lock everything down, but support the victims of health data privacy breaches. Because I learned an important lesson in the hospital and sitting on my couch uploading those uploading my labs. The current system is not serving us. We are hungry for answers personalized to us. And so I would upload my labs to Claude again. But to follow their catchphrase, I'm going to keep thinking, and I hope you do too.